Fans of General Hospital know Kate Mansi as Kristina, but behind the scenes, the actress faced a terrifying health crisis that almost cost her life. Back in 2015, Kate began experiencing intense abdominal pain, heavy bleeding, and nausea. At first, doctors didn't take her seriously. Some suggested her IUD might be the problem, while others said it was just a bad period, or maybe even the flu. For 4 straight days, Kate tried to push through the pain while continuing to work on set. By the end of the week, her stomach had swollen so much that she could barely zip her pants. Her makeup artist even told her she looked pale and unwell, but Kate refused to stop. She later described the pain as feeling like extreme contractions, filming scenes normally while cameras rolled, but doubling over the second the director called cut. Eventually, the pain became unbearable, and she drove herself to the emergency room. At the hospital, her mother and stepfather, an OB/GYN, arrived to support her. Scans revealed an 11-centimeter mass in her abdomen. Doctors initially feared cancer and called in an oncologist, but Kate's stepfather insisted that surgery could not wait. He stepped in to perform the operation himself, a decision that ultimately saved her life. During surgery, doctors discovered a ruptured ovarian cyst sitting on a blood vessel. When it burst, nearly 1.5 liters of blood leaked into her abdomen. The blood had clotted together into a mass that cut off oxygen and blood flow to her organs. Once the mass was removed, surgeons made another discovery: endometriosis tissue, in a painful condition in which uterine-like tissue grows outside the uterus. For Kate, it was the first time she had ever even heard the word endometriosis. After surgery, she needed blood transfusions and spent several days recovering. The experience was terrifying, but it also gave her the clarity she needed to understand why she had been in so much pain. Since her diagnosis, Kate has spent years researching endometriosis, learning how to manage flare-ups, and taking steps to protect her fertility, including freezing her eggs. She credits her husband, Matt McInnes, for being supportive, understanding her condition, and helping her not let it define her life. Now, Kate is using her platform to raise awareness about endometriosis. She recently directed a General Hospital episode addressing the condition, showing Kristina's sister Molly struggling with a painful flare-up and having an honest conversation with her boyfriend about what it's like to live with this condition. Kate explains that many people with endometriosis hide their pain to appear strong, and she wanted the episode to show both vulnerability and resilience. The story resonated with the cast and crew, several of whom shared their own experiences with endometriosis, highlighting how common and impactful this condition really is. For Kate, the goal is simple. She wants people living with endometriosis or similar conditions to speak up, share their stories, and not suffer in silence. Her journey is a powerful reminder of the importance of listening to your body, advocating for yourself, and seeking help when something feels wrong. Through her courage and willingness to share her story, Kate Mansi is not only inspiring viewers, but also using her platform to make a difference, proving that raising awareness can truly save lives.